on the road for my baby. I've had a few transfers that have failed, but we are still on the journey.
Mm.
I have fertility coverage at a job, and I used it all up. So I had to get another job that had fertility benefits. So I just recently got that not too long ago. Everything is kicking in because I just saw like some emails about
Mm.
insurance and stuff. So I got another one. So we'll work on that because I don't like paying for it. So
Okay. No, that's right. Yes, yes.
this journey is the hard part. So I was like,
Mm-hmm.
okay, we got to find another job that has fertility benefits. So I did
Mm-hmm.
that, and now I probably start sometime next year. Get my endometriosis probably looked at again. Maybe possibly do surgery before I transfer again. I think that's probably the best thing to do. Probably the next time.
Mm-hmm.
So that is me in a nutshell. Without further ado, and did I say your name right?
Orvia. I mean,
Orvia.
some people say Orvia, some people say Orvia. Look, it's all the same, all the same, all
It's
the
not.
same.
Honestly, what's your mama? What's your mama call you?
She calls me RV. RV. Yes, that's what she called me. Yes, that's what she called me. Mm-hmm. Yep. Or she called
R.
me Miss Chin, but yeah.
That's another story.
Mm-hmm. Yeah, yeah,
Um,
yeah.
Arvia is to the panel
Orvia.
today.
Yeah. Mm-hmm.
Or
Yeah.
to the panel today. She's going to talk about her journey. And let's start from what you say is you are on your second marriage, so you suffered through infertility through your first marriage,
Yes. Yes.
and this whole time, I'm curious just to see, did you just like were you trying and then like nothing happened, or did doctors just say? Because I know you said in your
Yeah.
synopsis that the doctor said that you were fine,
Yeah.
but
Yeah.
turns out you weren't.
So yes, we were trying. Well, we weren't not trying. Okay, if that makes sense, right? Of course,
Right.
I've never ever been on any sort of birth control. The actual first time that I've ever been on birth control was through the IVF process.
Right.
And so, yeah, I was not getting pregnant. Just talking to my gynecologist, basically she was saying, nothing's wrong with you. You're young, it'll happen when it happens. They did suggest like timed intercourse and things like that. But, we did at one point, they did suggest that my ex husband do like give a sperm sample and all of that. But unfortunately, he didn't want to do it. And now we come full circle and we accept the fact that, everything happens for a reason. And
Right.
now being married for the second time and the last time, might I add, I can truly say that, like, going through all of that, I believe that it was not supposed to happen that way. And so I just, I have, in looking back, of course, you think like, back during that time in my first marriage, oh my gosh, why is it not happening for me? You know what I'm saying? What's going on? Things like that. And you don't know if it's the other person. But, now come to find out, it just wasn't supposed to happen. With him, it just wasn't supposed to happen. So yeah, that's basically, in talking to the doctors, basically told me, it'll happen when it's supposed to happen. They suggested timed intercourse. We tried that, but when you're trying to do that, like, it just makes it more of like a chore. And
Right.
it just doesn't, and then it adds stress to the whole process as well. It adds another level of stress to it. So but yeah, no one suggested to get like a HCG. None of my doctors suggested getting any sort of like, I think I did get some hormone blood work, some hormone testing at that time as well, but nobody, like, it wasn't anything that was out of the ordinary. Nothing seemed like off or anything like that. So yeah, I was married for almost 7 years, first marriage, and then in after meeting my now husband, and us, also continuing to try as well, and nothing happening. At that point, I was just like, it'll happen when it's supposed to happen. I did think at one point that, okay, something is going on, something is wrong.
Right.
I at the least, I thought that at least one of my tubes were blocked. At least one. I was like, it has to be something, right?
Do you
Because
think they didn't do anything or didn't worry about it because you were young at the time?
yeah, and I felt like I had time, right? We were living our
Right.
best lives, we were newlyweds, we were traveling and all of that. And actually, just a little bit. So both my husband and I, we were both working. We had both been at our jobs for a very, very long time. Like, I had been at my job for almost 14 years, he almost 12 years. We were both making like well over six figures. And I don't know what it was, but God at one point in time told us to move. And we moved from Virginia to South Carolina. We left our jobs of, making really good
Wow.
money and everything. And with the company that I was working for, they did not have any sort of fertility benefit with the health insurance, right? So, in moving from Virginia to South Carolina, my husband actually he was offered a job at a company in Greenville, and it unfortunately did not work out for him. He didn't really like it. He was offered another position somewhere else, but when he was offered a job there, his like the upper leadership, I guess his boss, she wanted to meet me, and so she wanted to go out to dinner or lunch or whatever, and we met her for lunch, and she asked me what I did. She suggested that I apply for a position there, because I wasn't tripping about it. My husband was just like, just take your time looking for a job. She suggested a role for me to apply. I did, and he had left the company. And so, me looking through the insurance on their website, I found out that they actually had a fertility benefit. And so I was like, let me just see, like, let me
Right.
see what it's all about, right? So,
Right.
talked to my gynecologist at the time, and she told me about a fertility clinic that's in the area and that they partner with them. And so yeah, that's basically how it all started. I was like, okay, let me see what they offer. And a lot of people are not familiar with I've never heard of the name of the company, but it's called Carrot. It's
Fertility.
yeah. hmm
Yes.
And my job partners with them, and they give you literally like
Reimbursement.
$20,000 on a Visa debit card for you to pay for fertility benefits. And had I like my husband, like I had insurance when he was working there, I had insurance under him. Then when he left, I was like, I like their insurance better. We like the insurance. So I was like, well, you can come on mine. But when he was there, I guarantee he wouldn't have known about the fertility benefit.
No.
He wouldn't have, he would just like, have set it up like, okay, family plan or whatever the case is. But when I ended up, getting a position there, I kind of looked into it deeper, looked into the insurance, and found out about the fertility benefit at that time. And it's really not even reimbursement. They literally, you do a couple of like modules, and they literally send you a Visa debit card with 20K on it. And unfortunately, it didn't cover everything, but it covered quite a bit. So
Right.
yeah, I was shocked how easy it was, but that's basically how it started. And so I really believe that like the only reason like that we ended up moving to South Carolina was because we don't know anybody here. We know nobody here. We don't have family here or anything like that. And um, I think it was just a step out on faith to leave our positions where we were at in Virginia, and just like trust God in it. And I know some people say like, well, why are you going through IVF if you have faith? And I always tell people, like, God didn't need help. I did. So he
Right.
set it up for me to get what I needed. You know what I'm saying? And that's what I truly believe. And so yeah, that's basically like how I ended up going through IVF. like the start of it.
So you find out you have Surance, which I'm
Mm-hmm.
a pro. I'm like, listen, I'm a pro advocate of. A lot of people want to do, and you can do this any kind of way that you want to. There's not right or wrong way. You have to do what's
Mm-hmm.
best for
Mm-hmm.
you. Some people take out loans. Some people do second mortgages. Some people take out their 401k.
Mm-hmm.
You know, some people, apply for grants. Some people do GoFundMe, puzzle pieces.
Yeah, all of the
You
things.
know, and I always say, look, the easiest way to do it, or the one you're either gonna do one or two things. You're gonna do your time, or you're gonna spend money.
Mm-hmm.
And for me, I rather do my time. I went to a place, they paid for it. I ran out. Guess what? There are other places that offer it. So now I'm at another place. You know, money will always be there for me. I'm like, I can take this, leverage it, go somewhere else, maybe
Mm-hmm.
later.
Mm-hmm.
So for me, the sacrifice, I took a pay cut initially.
Mm-hmm.
I took a pay cut this time again. Um, but the benefits still are great. So Carrot, Maven, so there are three outside companies that do it.
Yeah.
There's Carrot that she did. There's Maven Fertility, and then there's Progeny. I have Progeny.
There's
And they
another
take
one
care.
similar to carrot. I can't remember the name, but I'll have to look it up. But
It may be Maven. It may be Maven
it
Fertility.
starts with an M. I don't think it's Maven, but it does. I think it
Yeah.
does start with an M. I
Um,
can't remember.
there's Win Fertility. Oh, and then there's Win Fertility as well.
Win, not an M.
Win
It's Win.
Fertility, yeah, Win
Win.
Fertility. Those are the four that are outside, and then the rest are maybe be in house. So it all depends on your employer.
Mm-hmm.
But
Mm-hmm.
Win, Maven, Carrot, and Progeny all are fertility insurances that partner with your employer's insurance, essentially. So they'll
Mm-hmm.
do the claims and all that kind of stuff sometimes through your main insurance, like Blue
Yeah.
Cross, Aetna, but they talk
Blue
to
Cross,
each
yeah.
other. It makes it more seamless because they deal with all the fertility stuff, and
Mm-hmm.
then they're like your liaison.
Mm-hmm.
But you're the first person that actually has, so I'm glad that you're talking about Carrot, um, because they are one of the newer companies that offer with fertility. So,
Yeah.
um, and I'm glad that you said that because a lot of people just aren't sure how it works. But you do. You're saying you get a credit card,
Yep.
um,
Think you
and
do
then
like a few modules first, and then they ask you a few questions online. They ask you like, how long have you been trying? Is this benefit for you or for your spouse or for the other person? They ask you a few little questions, and then you do like a module or two online, on the app, and then they send you the debit card. And like the first time that I tried to use the card at the fertility clinic, it was for like one of it might have been no, it wasn't for the HCG. It was for something. I don't remember what I was trying to do it for, but the transaction didn't go through the first time. However, Carrot basically called me to like confirm that I was at the clinic or whatever the case is, and that's what it was for. And then after that, everything, was going through okay. So, and then we used that. And then, of course, savings. And I think we pulled a little bit out of 401k too for it as well. Um, because the actual charge, the payment for it, the clinic, the amount that they give you, the pricing that they gave us, it did not include meds, and it did not include the HCG for me. And it also did not include, because I also had I had a uterine biopsy prior to doing transfer to make sure, essentially because I'm not sure if, so we only had the one healthy embryo after, retrieval and all of that. And so my doctor did suggest that we do the biopsy just to check my uterus. He did say that normally they only suggest that to women who have had miscarriages, multiple miscarriages. However, in our case, because we were so adamant about the fact that we're not doing this again, we're not paying you guys, because of course he suggested, okay, we can do another egg retrieval. We can, do another round, and we told him no, that this is it, like, this is it. So that's when he suggested to do the uterine biopsy prior to transfer, just to see the health of my uterus, make sure it was good before transferring. I think that that also played a huge role in, the success of our transfer. So yeah, we that was not covered under that we were not able to pay for that with the benefit, fertility benefit, and that was, I believe it was about $500 for that,
Yeah.
for that
I'm
biopsy.
surprised that some of it they didn't kick back to your medical though. So like your HSG should have been kicked back to your medical. Your even like your uterine polyps removal that should have been kicked back to your medical. But
Well,
um,
the my surgery was kicked to my removal
medical.
of my tubes. Yeah, that was through my medical. While
Yeah.
she was in there, she did do the removal of polyps at the time as well. Um, it was a different doctor than my fertility doctor. It was with the same fertility clinic. However, my doctor, he did not perform the surgery. So we had to go to Columbia, South Carolina to get the procedure performed by one of the doctors at the clinic there. But we, of course, I got it done at the hospital. But yeah, she actually
Yeah.
performed it. So yeah, some of it wasn't covered, but the majority of it was for sure.
So what were your thoughts? You start your medical, you do your consult, you have your first meeting. They do
Hmm.
all the things. And usually your
Hmm.
first appointment, they're gonna do blood work,
Yep.
and they're gonna do they're gonna say, we're just gonna check and choose, just make sure. So what were your thoughts when you did your HSG and it said that both your tubes
Mm.
were blocked? What
I
were your
think,
feelings?
I think that was literally, I think that was the hardest part of the whole process for me. I think that was the hardest part. That was the most traumatic for me. Um, yeah, because like I said, I was prepared for them to say, okay, one of your tubes are blocked. But I think like laying on the table, my husband was in the room, but he wasn't able to be on that side of the curtain because of the, x-ray and all of that stuff.
Right.
Um, and the doctor that actually did it was a doctor that was worked for the clinic. However, he was not my doctor. My doctor wasn't there that day. And so he he didn't know me. He wasn't, I don't feel like he really like was sensitive to, you know, the fact that I'm having this procedure done. He didn't know my backstory. He didn't know my back. He didn't know what, any of that. So literally he was just so quick with it. And he was like, so put the dye in or whatever the case is. And we're looking. And of course it's a little painful.
Right.
But we're looking at the screen and he's like, okay, it's taking a little bit of time to, get there. But he was like, it does look a little slow. But then he was like, okay, we're gonna wait a little bit and see if anything sprays out. And then he was like, well, both your tubes are blocked. He said it just like that. He was like, well, both your tubes are blocked. And I looked at him like, are you serious? And he was like, yep, they're both blocked. We're going to go ahead and tell Dr. Payne, you guys are going to have to figure out what you're going to do. And yeah, all right, so hop on up. Like, that's basically how it went.
Yeah.
And like, I sat up. The nurse was in there, and I sat up. And then when my husband came from around the side of the curtain, and he looked at me, that's when I just like lost it,
You
right?
lost it. Yeah.
I lost it. I absolutely lost it because again, I was prepared for at least one to be blocked, but not
Right.
both of them. And my husband has,
Why were you prepared for one to be blocked? Like what made you
because
think that it was blocked?
I just said to myself like it has to be something. If
Right.
all of this time, you go to your yearly, your annuals, you get your pap smears done, and it says nothing. You've had blood work done before for your hormones. I didn't have bad periods. Like my periods have never been like oh my, like I barely even take anything when I'm cramping. You know what I'm saying? Like, so I
Right.
didn't think it was anything too crazy that, like, as far as like endometriosis and stuff like that, I just, I don't know. I just thought that, okay, it has to be something that I'm really, that they're not able to really see. And so that's why I was prepared for, okay, if one is blocked, then okay, I can, not that I can accept that, but like, okay, that explains it kind of like thing. That's what my mind was, where my mind was going. But when he said both of them and then seeing it, like seeing my tubes blow up like they did when the dye was put in, and nothing come out, like a little, like a tear or two was starting to trickle down. But then, like I said, when I saw my husband, when he came from around, I just like, I felt like a failure. Like at that point I felt completely like a failure. Like I felt like, you, like, no. Because like I said, my husband, he has 3 children from his first marriage. And I always, of course, I've always wanted to be a mother. Always wanted to be a mother. I knew that this was going to be my last marriage. I was not getting married again. I knew that this was the man that I wanted to have children with. And I was, even though we had children from his first marriage, because they're my babies too. At that point in time, I felt like a pure failure. Like I felt like, man, Orvia, like you're 38 years old, all of this time. And like, I felt like it kind of made it seem like to me that I had a chance to get this procedure done in the past. I should have known about it and I should have suggested it like in the past.
Right.
And, this man, although he has children from a previous marriage, he also expected to have children with you. And at that moment, my mind wasn't on IVF at that point. My mind was just on the fact that I cannot produce a child because my tubes are blocked. And yeah, that was basically that's how I felt. That's what came over me. Like I said, I broke down at that point, and it was yeah. And I think, like I said, the doctor, he was just not sensitive to, it's just like I was just like a number to him. Like, all right, let me get through this, type of thing. So yeah.
I say fertility doctors, most, there are a few that are, like you said, you didn't have your doctor. I love my doctor because he's not like that. But I've been to fertility doctors. I remember the first one I went to, the consult, she was like, oh,
Mhm.
you'll come back on your cycle day one. And, and I went on my cycle day one and she was like, well, you got cysts. So yeah, this is not going to work. And I was like, wait, what? And I was like, and like you said, I think it's like your first experience. You don't know what
Yeah.
to expect. You
Yep.
don't know what you're getting into. You sit
Yep.
here, you have this consult, but you don't know what anything means.
Mhm.
And then when things aren't right, they just throw their hands up and be like, well,
Mhm.
that's that. And you're like,
Mhm.
what do you mean that's that? Are you going to help me?
Yep.
It's just so insensitive.
Very
And
much.
so you're already feeling like, I'm not even supposed to be doing this
Yeah.
because you know, you don't know, especially if you don't know anybody who's done IVF.
Mhm. I
I
did
don't
not.
know. I don't even know I even needed this. I've
Yeah.
never even thought of this even as an option growing up. And now you're giving me this news, and there's nothing it's not warm at all.
Mhm.
It's
Yeah.
like, what am I supposed to do with this information?
Yep.
What are the next steps? And then you gotta wait because he's not your doctor. And he's like, well, just speak to your doctor. You
Yeah.
can find out
That's what
next
he
steps,
said.
and that could be
Exactly.
a week from
Yep.
now, 2 weeks from now.
Yep. Mhm.
And you're
Oh
just
yeah.
left in the dark. It's like,
Yes,
bro.
exactly. Like I lost it. I literally, like, I lost it. The nurse was come for my husband was there, of course, trying to comfort me, but the nurse was there. Like the doctor had walked out of the room. The nurse was
Of course.
trying to comfort me. She brought tissue and all of that, and my husband was there, and I was just like, this cannot be like my life like right now. Like this is not real. Like again, like I was a little prepared for them to say a one, and I don't know how I would have. I probably would have, of course. been emotional then too,
Right.
but I think when you say both, you have, because I've heard of people still being able to conceive with,
One.
with one being blocked. Of course, it happens, right? Um, and also, like, I had, in the past, I had done things to try and improve chances of conceiving. Like, I had done the, what is it, castor oil packs on your abdomen. I had taken like fertility teas to try to, like, help us conceive and stuff like that. Not that, I mean, because I was just thinking, okay, something's going on, it's not happening. So I really did try multiple different things in the past. um and with talking to my doctors in the past, and I'm saying, no, nothing's wrong with you, they're not able to see anything. It kind of like made me, okay, well, maybe I'm going to try my own way. And
Right.
like I said, I did the whole castor oil pack stuff like that, and nothing really, nothing worked. Like I said, I've never been pregnant before, never been on birth control, you know what I'm saying? So, um, and of course, and also, like I said, I didn't even know that the HCG thing was actually a thing. Like, I had no
Yeah.
idea about it. It was just after my consultation with my fertility doctor that he was like, okay, we need to do, after I did blood work, he said, all right, the first thing we need to do is check your tubes and make sure that they're
Right.
open. And so I was like, okay. But yeah, so yep.
So we get past that part, and then um, you and that's what people and it's not uncommon for when they know that your tubes are blocked. We know we're going to do IVF. It is not uncommon for them to say, let's just remove your tubes, because again, that's going to be something that may impact
Hmm.
your pregnancy. So
Hmm.
there's an issue. So it's not uncommon for you to get your tubes removed,
Hmm.
to just eliminate any kind of infection or anything like that, because that just tells them that there may be something that's going on for the reason that your tubes are blocked. So now you make that decision, because I'm assuming you did it before you did your egg retrieval.
Yes, yes. I
Okay.
had my tubes removed in January of 2024. I'm sorry, 2024. I had my tubes removed, and um, like, I did get questions about, like, well, why did you get your tubes removed? And like you said, so my doctor, he suggested it. And at first, I was like, well, I don't know if I should get them removed, right? But then I prayed about it, prayed about it. My husband and I, we prayed about it, and knowing that we had the one, shot, as far as financially, we were only willing to do this one time. Um, my We prayed about it, and I said, I told God, I said, God, if it's in your will, even if I get my tubes removed, it's still going to happen. And so it didn't take us long to call the doctor back and tell them, all right, we're going to go for it, because he did suggest IUI. And it didn't take us long to, I said, all right, I'm not going to, like, I'm not going to drag this out. I'm not going to do that. We're just going to do it. And so that was in uh, October of 2023, when um, we found out about my tubes being blocked. However, of course, it's the last quarter of the year, and
Right.
everyone's trying to get their surgeries done. Everyone's trying to get,
Oh yeah.
tubes tied, all of that stuff, right?
Oh yeah, we trying to get that.
So,
Listen, let it stay in that deductible. I'm getting it for free. Okay, I didn't
exactly.
use my money. I need to get it for
Yes,
free.
yes. And so, because we were like, once we agreed to it, we are like, okay, when can we get it done, right? And when my doctor looked at the calendar, he was like, well, you're not going to be able to, we're the doctor that does them, we're not going to be able to get it done until the next year. And so that's when we got put on to, that's when we, decided, okay, we're going to do it. We got put on the list for us to be one of patients to remove bilateral salpingectomy. And so that's why I had it done in January of 2024.
Okay.
And yeah, that's when I had it done. And some people like ask me like, did you feel like, how did you feel after, getting your tubes removed? Like I had a short stint of, man, like I have a piece of me that I was born with, I was created with, that makes me a woman that now I no longer have. And the only way that I will be able to conceive is through IVF, right? So I had a little bit of, it was definitely emotional at the beginning. Um, but in prayer and just like I said, continuing to tell God, all right, look, I'm stepping out. Like, this is what it is. I'm just gonna believe that if it's supposed to be, it's gonna happen regardless of if I have them, or if I, with me not having them. So yeah, that was definitely, so yeah, I had them removed in January of 2024. Yeah. And it took, well, the recovery was probably about 4 weeks, but um, probably about 4 weeks. But I think we waited 6 weeks or 6 or 7 weeks until after my surgery for me to go back in and then kind of start the IVF process. Because he said, you can start once you feel better, but just in us, like, me trying to like take my time and really make sure that my mental, that my emotional, that I was kind of like really prepared. I didn't want to like rush into it. I just wanted to really, really like be prepared for it, and as much as I could, because we can't control so much of this process already. Like,
Right.
so much of it is not under our control. A lot of it is timed, and you have to do this appointment at this time and all of that. And so I knew that once we agreed to do it, it was go time, and so I really wanted to like just kind of get my mind prepared and not rush into it too quickly. But it just took a couple of extra weeks just to kind of like, you know, simmer on it a little bit. Um, but yeah.
So you started the process around 38?
Well, I got my tubes removed at Lord, how? Oh, I was 39 when I had my tubes removed. No, 38.
39.
38, going on 39.
39.
Yep.
Now, because you're advanced maternal age, was there talk about before you did your egg retrieval? Um, I'm assuming your AMH was, because you did a pretty good retrieval, so I'm assuming your AMH was pretty decent
Yeah, my AMH
still.
was good. Yeah, all of that was good. Thankfully, there was no issues with that. Um, and it was like, I guess, well, they said that I had like my egg retrieval. I had, I think I told you, like, there were 14 eggs retrieved. Now, I will say that my
Right.
follicles were not growing
Okay.
as quickly as they wanted. There was one of my checkups after doing stims, or after starting stims, where I went in and they were like, I asked them, like, what number do we need to be at for us to be like, okay, we're going to go forward with retrieving. Um, and
20 mil, 19,
I think
20
she said
millimeters.
20 or 22, or so she said between 20
Yeah.
and 22, something like that. And I
Yeah.
think like some of my follicles were like 9 and 10. And then
Yeah.
my retrieval was scheduled very shortly after that. And so I was like, oh my gosh, like at that point, my doctor did increase one of my meds.
Right. More
Um,
money. More
yeah,
money.
yeah.
Yeah.
Well, it didn't. Well, he increased one of my meds. I had those meds already.
Okay.
I did end up having to purchase another one later on. It was the Gonal, the inject pen. Um,
Gonal-F.
yeah, he wanted me to increase that. And so yeah, to see if that would help with my follicles growing more, which it did help. So thankfully everything looked right for retrieval. Um, but yeah, I think yeah, it was Gonal. It was the Gonal-F. Yeah, that's what it was. It was
Yeah.
just that one.
Gonal, probably Gonal, Menopur, because you did Gonal, that means you didn't do follow stem. So you did Gonal, probably Menopur, and probably Pregnol for trigger.
I think it was Pregnol. I
Yeah,
can't
Pregnol
remember
is your
to be
trigger
honest.
shot.
To be honest, I don't want to remember none of the medications ever, 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 ever again. I don't want to remember none of them. All right, you can't keep them. Matter of fact, when it was time to dash them away, I was like, let me get rid of these. Okay, I was just,
Are you
oh my gosh,
Caribbean?
I'm from Jamaica. Yeah, I was like, oh my gosh, I don't want to, I don't want to deal with none of them anymore. I was so over
Anymore.
it.
I know. I know. I have
Over,
a drawer sitting down here at the
over.
bottom of here. The way I can't wait to just get rid of that drawer. It's got like
I know it,
progesterone, it's got needles, it's got all kinds of stuff.
girl.
I'm like,
Yes,
Lord, if you can just, I just want to get rid of this drawer. I am
yes.
sick of just taking up a drawer
So
in my house.
tired of
I'm
looking
like,
at
it's
it.
gotta go.
Mhm. Yes, and I even at one like once when we were finished, like I even kept my meds, the ones that needed to be kept in the fridge for I kept them for a little bit. I even posted it on like a little Facebook group where people. I was willing to just like get somebody to just
Donate it.
donate it, right? But
I
nobody bit. So I waited a little bit of time, and then after that, I was like, I'm tired of seeing them. I was yeah, they can go.
I
But
would
yeah.
still say at your age of 14 eggs is still pretty good.
Mm,
And just so people know, um, as you get older, it does require sometimes more medication, and sometimes your doctor will let you know,
mm,
even if your AMH is good, our age is just not on our side when it comes
mm-hmm.
to
Yep.
IVF, and so
Yep.
you may run into to a situation, and you don't necessarily have to do with age. It's just that this is something new that you're giving your body, and so a lot of
Mm-hmm.
times women don't respond to the first round
Mm-hmm.
of medications. They usually respond, to the second or third one.
Mm-hmm.
And so it may require your body more medication in order to do a proper egg retrieval. But the
Mm-hmm.
fact that you got 14 eggs, like, you know, at 39, that's pretty good. So you get to the egg retrieval to get 14 eggs, and what are your feelings like? Are you hopeful? Do you feel like this is good? I know a lot of people don't think that 14 eggs is a lot, but I'm like, the 14 eggs is a lot. Because I know, like, especially you go to other groups and you see, like, oh, they get 50 and 30 and something
Yeah.
eggs. I'm like,
After doing
okay,
research,
they're
so a lot of
borderline
women,
PCOS.
yeah, that's what I was just about to say. Yeah, a lot of
Yeah,
women that do have that, I learned later, that
right.
that's probably the case. When they said, well, the doctor said 14, we got 14, and that's good,
Yeah.
we have 14. And so I was like, okay, great, excellent. And then, he said, all right, we'll call you by the end of the day to let you know how many matured or how many, fertilized. And then, we'll follow up, update you as, the week goes on, and we'll see how many go to blast and things. Uh, yeah, I was
So the 14, how many fertilized?
7 fertilized.
Okay, so that sounds about right. So you lost half,
Mm-hmm.
and your feelings are,
I was like, definitely like, oh gosh, okay, ththese numbers drop really fast. Like
yeah,
this
it's real
dropped
fast.
very, very quickly. Like,
Very
okay.
quickly.
And then I was like, because I didn't really have much knowledge on the whole process. So like,
Yeah.
I'm like, talking to my husband's like, well, what they doing with the rest of them? Like when they say that it fertilize, like what do they do with the rest of them? I'm like, well, shoot, I don't know. Like, you know what I'm saying? So,
Right.
7 fertilized, and then 4 went to blast, and we,
Blastocyst.
yeah, and we PGT tested, for all 4 of those.
And we
Yep.
got back
And
one
that
normal
one
embryo.
healthy normal embryo. And when, like, I had asked, once we got those results back, um I had we requested a consultation with the lab, because the clinic doesn't break it down for you, but the lab
Right.
will kind of like break it down for you if you have questions regarding, what does this mean regarding,
Right.
the health of the embryos, the chromosome makeup, all of that. If you have more questions about those, you can talk to the lab. So we scheduled an appointment to discuss it with the lab, and this was another part of the process where I also again felt like it, I just failed at some point, because all of the abnormal embryos, the chromosomal makeup, that whether it had an additional chromosome or didn't have, you know, the full 22, where, or it didn't have enough, was due to the health of the egg, not of the sperm. And that's what the lab told me. This they explained to me that this one is, unfortunately, this is because of the health of the egg and the quality of the egg. And so that, I had to, in talking to my husband, I definitely had to like really like just like it was definitely like straight. It made me just feel horrible, because I was like, like I'm the reason why we don't have these other four healthy embryos. But essentially, it was supposed to happen this way anyways. And in addition to that, we never wanted to know the genders of any of the embryos. I know so many people say, oh, I just want a healthy baby, just want a healthy baby. And literally, we just wanted a healthy baby. And so that's why I was like, it doesn't matter if it's a boy, if it's a girl, of any of them. So we didn't know this. I will say, when the nurse called me, when they got the results back for the embryos, when my nurse called me, she was like, "You guys said you didn't want to know the genders, right?" And I was like, "No," because I was at work. I like left my desk. I went outside. She was telling me, okay, this embryo was this grade, and this grade, and then she was like, "You guys didn't want to know the how the genders, right?" And I was like, "No, we didn't want to know." And then I said to her, I said, "Well, since now we know that three of them are not healthy, go ahead and tell me." And then I had to stop myself, because my husband and I, we both originally agreed not to
Right.
know the genders. And I just felt
Right.
immediately, I felt bad, because I was like, thinking to myself, well, they're not healthy, so might as well learn them anyway. No, what are they? But then I had to stop myself, and then I told her, oh, no, my husband and I, we agreed not to know the genders of any of them. And because she was going to email them to me, and she was going to put the genders up there. I had to
Right.
actually call her back and tell her, no, please black it out, so that we don't see it. But yeah, so we had just the one healthy embryo, and it was a 4AA. Um, my clinic actually does not. I know some clinics do transfer, depending on what the grade is. Some of them do
Right.
transfer abnormal, but my clinic does not. So if it was not a normal embryo, my clinic would not transfer anyway. Um, and so, yeah, when we got that result back, it was definitely it was a shocker to me, because I was like, okay, doing the math, like, okay, if seven of them went fertilized, we have four, so I'm thinking at least two, at least
Right.
two. We're
Yeah.
doing
Yeah.
the math, right? At least two,
Right.
but no, just that one,
Just the
just
one.
just the.
And you're right. So depending on the level, so sometimes you have mosaic. It's called
Mhm.
mosaic embryo.
Yeah,
So if they're low level mosaic, so I
yeah.
have some low level mosaic embryos. Your clinic may allow you to transfer those, but usually they're high level, complex. They
Hmm.
say no.
Yeah, yeah.
Um, they usually don't budge on that one. So yeah, it just depends on your clinic.
Hmm.
Um, some people say like I still have them because they, I said should I discard those? my clinic said no. Science changes, and you just never know
Mm.
if if we can use those. And there's a lot of low level mosaic embryos that
Yeah.
turn into healthy ones. We had D on here. She transferred her low level little boy, and she's having a very healthy pregnancy. Her
Yeah.
baby is growing just fine.
Such a
So yeah, you hold on to them just in case, or you donate them.
yeah.
Whatever people decide to do with them. But you just do what's best in the time. So now you get it back, and we're focused on the one embryo.
Mhm.
We've gotten through the. Okay, we got one. Okay, Lord, what we gonna? Okay, Lord,
Yeah. Yep.
you really tested my faith here.
Yes. Okay. Yes, honey.
I
Yes.
know what I said, but you
Uh-huh.
really, you really put me to the test.
Yep. Yep. And one thing that always continued to come to mind was God just kept telling me, like, I created you as a woman to birth life. So, although may not happen the way you want it, it may not be conventional, it may not be the natural way, it doesn't mean it's not possible. And he just kept telling me that. He kept telling me, I created you to birth life. And so he also kept telling me that he can do so much with nothing. So just imagine what he can do with one. You know what I'm saying? He can do so much. He like he doesn't need need my help. And so I just continue to like meditate on that, continue to meditate on that. And I was just reminded constantly that um, I was created to birth life. And although it may not have happened in the past at the right time that I thought it should have happened, this was all like it, this all was supposed to be like this. Another thing that I just, kept saying is that, kept telling myself is that God is that basically based off of the whole timing thing, right? Why is it that I'm gonna be 40 and be pregnant for the first time and all of that? And God just kept telling me that He had not forgotten about me. I've just had to wait differently, and I accepted that. He never forgot about me, because at some point in time, I definitely felt like he forgot about me. More so in my first marriage, because I was in that marriage for almost 7 years and then never got pregnant. You know what I'm saying? So yes, there was times where, of course, I cried in the shower, like, God, why am I continuing to go through this? Why is it that I'm not able to produce a child? Why is it that I have to be the one to experience this? What did I do, type of thing? And he just kept telling me, like, I have not forgotten about you. You have just had to wait differently. Your wait is different than other people. And that was just constantly replaying in my mind. Your wait is different. Your wait is different. Your wait is different. And so that was what really what got me through. Like, we can control so much of this process, but there's the things that we can't, that we can control. We need to focus on that. But what we cannot control, we have to really have faith that it's gonna all line up for His will. And that's really what I just continue to say, like, okay, the only thing that I can focus on, that I can control, is my ability to believe that it's gonna work, my ability to trust God, my ability to make sure that my body is healthy, my ability to make sure that I'm putting good things in my body, that I'm not watching certain things on social media that pertain to like miscarriages and failed transfers and things like that, because that's what unfortunately it's easier said than done, because we get in our heads and things like that, and then but we don't really know how much it really affects our own psyche and our own mental if we watch certain things that we know is the opposite of what we're trying to achieve. And so I said, okay, I can focus on making sure that I only put good things in my mind, that I only put good things in my body, that I'm making sure that I am treating myself well. I know that a part of this process is you have to, it like stress is a huge factor in this whole process, right? So, once we got a transfer date, like once we got, confirmed transfer date, well, even before then, when I was doing egg retrieval, before egg retrieval, or once we were doing stims, I should say, I started getting monthly massages. Like I would do solo dates by myself. I'm gonna go and whether it's go to the park and have lunch, or I'm going to a cafe to have lunch, or whether I'm just gonna go and do a full spa day just for me, or whatever the case is, like, or whether I'm gonna go and take a drive to my girlfriends in Atlanta and we just gonna spend the weekend together, or whatever the case is. I just made it I decided that what I can control, I was gonna control. Like I'm not gonna go on YouTube and watch stories of failed transfers, because although I have sympathy and empathy and I'm empathetic to that person, that is not what I'm looking to achieve. I'm not looking to get influenced by that, because essentially that's what that is. It's kind of like they're telling you their story, but you start to, it's just natural for us to start to think, man, is that going to be me, kind of thing. And knowing that we only had the one healthy embryo, I just could not allow myself to get to that place of thinking negatively. I had to focus on what I could focus on, and to make sure that I was as stress free as possible. They say, do acupuncture. Unfortunately, after doing research, I just was not comfortable with doing acupuncture. So that's why I opted, when we started stims, I started getting monthly massages. And then once we got a transfer date, I was getting every 2 weeks. I was in there.
Nice.
I was like, okay, I need to make sure I'm stress free.
Get that blood flow going.
What I'm saying? All of that. And so it just was very important to me to make sure that I treated my body well, that I didn't put, I set time out for God. I had my time with him on a daily basis, and that's where I continue to get encouraged and stay encouraged, because it's so easy. So much information is online, and you can so easily get discouraged by listening to failed transfer stories. And like I said, yes, you want to be empathetic to that person, but you also have to first think about your own journey and what you need, because some people are strong enough to watch that stuff and not allow it to enter into their spirit. But me, because I know that, like, I feel like if someone's hurting, like I feel like I'm a crybaby. Okay, baby, it's gonna be like that. Okay, so I know that it would affect me differently, and so I could not put myself in a position to where I watch those things to make my mind go to that point. So yeah, that definitely was a big part for me, something that I decided and I committed to doing, so that so that the things that I could control, I was able to control, and then everything else, I just had to continue to put it in God's hands.
And that makes a lot of sense. And I was gonna say that too. Like looking at your content, you did a lot of walks, you did a lot of journaling,
Yep.
you did a lot of the things, that you really, I could tell you focused really truly on that time, like your mental, because you knew that this was it. It was all or nothing. So you were putting everything, your fiber, everything that you could do,
Yes.
because she's right. There's just, especially if someone who has it together, you do the appointments, you do everything, you know what you're doing. And this is the one thing that you really can't control, no matter
Mm-hmm.
if you do all the right things or not.
Yep.
you
Yep.
ultimately know that you cannot
Exactly.
control it. So surrendering is a
Yeah.
very hard thing that many of us are unable to do, is just
True.
let go. And I feel like you did such a great job of trying to balance living your life,
Mm-hmm.
understanding this is a part of your life, but
Mm-hmm.
still living your life
Yeah.
and not and doing your best to not let it consume you.
Exactly. Exactly. I mean, one of the things like the journaling piece of it, like I started journaling in the beginning of this whole process, and like I journaled from what meds I had that I took, and then I wrote on that day, how do you feel? How do you feel today? And then I wrote a prayer after that. And however I felt, that's what led into whatever I prayed about. And I then when we got to the point of me of after transfer, I started stapling our ultrasounds in there and praying over those. Every like stapled, like I don't have it with me, it's in my bedroom, but like that journal is done. There's no more pages. However, it's if you flip through it, it's all of the ultrasounds, because being of maternal age, we tell you all of these risks as well. And so you really, once the transfer is successful, of course, you're, happy, but you want the pregnancy to be viable and you want a successful birth as well. And so it adds another layer of like stress too, and so journaling was a huge, huge part of my journey, a huge part. And that I think was something that I definitely committed to, because sometimes we could just get so lost in so many other things that we have going on. And my journaling was literally at work, because I get to work by 6:45 in the morning. I pull out that journal, I'm doing it. So then just 15 minutes, spend 15 minutes on it, get that done, and then you go on about your day. It's so easy for us to say, we can start. It's just really hard sometimes for us to finish something. We can start a lot of things, but it's about being consistent, and really just focusing on the end goal. And it was really just for my mental and my emotional well-being personally. Um, for me to be able to kind of get out my feelings, because although I talk to my husband about everything, and he did check-ins with me regularly, um, no one understands what you are experiencing, um, really, but you. I mean, yes, there are other women that have gone through it, but everybody's different.
So
Everybody
different.
handles certain things differently. Um, and so really, like, and you cannot hold that in. You cannot, you have to let it out somewhere. You have to put it down on paper. You have to tell someone that you trust, that's really going to really um, be sensitive to how you're feeling. Um, and you really have to be like, you really have to give yourself give yourself that time for you to be able to let it out, because no one really understands. Like, seriously, it's easier said than done. Like, um, so when we decided to go through IVF, and then I told my husband, I was like, I just felt led to really like to tell my story, because he was like, well, what if, you sure you want to like do that? Because I already really wasn't like, I never really showed too much of my personal life on social media anyway. But
Yeah.
my husband was like, you sure, right? And I was like, yeah, no, I feel led to really like. He said, well, he did ask me, like, well, what if it doesn't like happen? Well, if it doesn't, it doesn't. But I know that it's going to. And so, like, me documenting it on YouTube and all that as I was going through it, like, at times it was definitely like, man, like, what if you go to a doctor's appointment and you don't get the response or the results that you want? Well, we just gonna have to show the real. You know what I'm saying? I'm just gonna have to be honest about it, because
Yeah.
um, I just kept telling myself that even though there may be roadblocks, I know I am supposed to be a mother. There's no like, so when women say, oh my gosh, it just isn't for me, maybe it's not for me to be a mom. No, it's for you. You're a woman. God didn't create you as a man. He didn't bring you into this world with another body, body part. You are a woman. So yes, you are supposed to birth life. And so I get sometimes we say those things because we're so caught up in what our own stuff is, what we're dealing with. But no, I was created to birth life. I was created as a woman to birth life, and it may not happen the way I want, but it's going to happen. And I just have to wait a little different than other people have to wait. And in my waiting, the question is like, what are you going to do, Orvia? That's what I kept telling myself. What are you going to do in your waiting? Like, you're waiting on this doctor's appointment. What are you going to do? You're waiting on these results. What are you going to do? Like the time of the PGT testing results. Oh my gosh. Like, why is it taking so long? My husband's like,
Oh,
"Babe,
even like just the 5 days for
it's
the
only
retreat,
been a
like,
week. It's only been a week. No, what? No. Like,
yeah,
why does it take so long? Um,
yeah.
because
So I didn't do my own egg retrieval. I had a donor, but even
Mhm.
still, you know, I know that that first day because they got 20 eggs from her, and then like it was like 16, and then 16
Mhm.
fertilized,
Mm.
and that was the longest 5 days. I swear to God, of my entire life. Like I went to sleep like it's not. I
Yes.
think she had a retrieval like a Monday or Tuesday, and I think I got the
Yeah.
results like Friday. I
Yeah.
was like, this is the longest. Thank God that she didn't do it on the weekend. I was like, Jesus Christ. I
Mhm. Mhm.
was
Right.
like,
But that's the thing. We don't like to wait
I
for
was supposed to do.
anything. We don't like to wait for anything. We stand at the microwave just to,
Oh
when
yeah,
something is warming up. Like
yeah.
our patience level is like non-existent. And that's another thing. That's another thing. I have always prayed for more patience. And I've never been a patient person, but this process
Oh
forced
yeah.
me to be patient. My husband is
Just
the
to
most
hurry up and
patient
wait.
person I know. He's the most patient person I know. He's very, very patient. But me, no. Like if I want something, I want it now. I need to know what's going on. I need to know like all of this. But um, my prayer life and the journaling and all of that really, really helped me to be able to kind of like really like sit in certain things, like think about the process, think about what I was experiencing, thinking about like the results that I was getting, whether it was blood work or whatever the case is, like because it really the whole IVF process does take a toll on you. Some point of your life, it takes a toll, whether it's emotionally, mentally, physically, all of the above. It does take a toll on you. Um,
Yeah.
Going to doctor's appointments, weekly doctor's appointments. It's getting stuck multiple times, getting stuck, and then them telling you, oh, we need to stick you here because we didn't get enough blood here, or this vein is like, oh, this number is not looking like it's supposed to look like. It, it will drive someone. It
Oh
can
yeah.
drive someone to a whole nother level of crazy, right?
And people don't understand that, and especially if you done it like in my case, like you done it like a multiple number
Mm-hmm.
of times,
Mm-hmm.
you're just like, and for me, it was like the first time, um, my ultrasounds were great. Could never get blood work. You know what I'm saying? Like my veins will collapse. Then the
Mm-hmm.
second time was like, you know, ultrasounds were my lining was too thin this time,
Yeah.
but my labs were good this time. Like every single time, like it wasn't like the same process, so I could be prepared for it. It would be
Yeah.
something different,
Yeah.
or and so when you go through so many times, that also gets draining too as well,
Mm-hmm.
and people don't understand that. And when you have gone through so many appointments, so many things every single week, and like you, and in your case, they give you a timeline, and then you're thinking your retrieval's this day, and then
Mm-hmm.
you don't respond to the meds, and so now they're like, you got to come back. You got to take that time off to do
Yeah.
this. You got to run around and do that. You got to move things around. And
Mm-hmm.
people who have not been through that process do not understand
They don't
how
understand.
taxing it is,
Yeah.
because you don't know
Absolutely.
what you're going to do when you walk in that room and
Yeah.
you strip. You know what I'm saying? You strip
Again,
down.
for the umpteenth time.
Umpteen time. I mean, I don't know about you, but as some, now when I go in, they be like, "You want me to step out, girl? You fine." At this point, we go
Exactly.
together, so
Exactly.
you
Yep. Mm-hmm. Very true.
don't
Very
got to
true.
step out. It's
Yep.
fine. Like, don't even worry about it.
Yep. Very true.
That's how numb you become to the
Mm-hmm.
process, because it's just the same process over and over and over again, and you just hold your breath to say, Lord, please don't let it be another issue. Don't let it
Mm-hmm.
be something else. I
Mm-hmm.
just can't, I know exactly how you feel sitting on there at the table, and then they just saying, well, this is it. And you're going,
Yep.
okay, wait, what? Wait, what? Okay, I
Yeah.
got to keep, and then you're saying to yourself, I got to keep it together,
Yeah. Mm-hmm.
because I got to be strong. Like, I got to keep it together. And you like, but I can't keep it together. I'm about to lose it.
Yeah. Oh yeah.
And,
For sure.
it's just overwhelming and powerful.
Yeah.
So we got one embryo. We processed that. We
Mm-hmm.
get to your transfer.
Yeah.
How was your transfer? And then getting the news that you are pregnant for the very first time ever. 2 pink lines. You did it,
Mm-hmm.
Joe.
Girl. Well, transfer, let me say this. Transfer, I think the transfer was the second most traumatic
Oh
experience.
gosh.
And I'm going to say that because my doctor, they give you a time to come in to do the transfer. And my doctor, he was in with another couple. And you could hear that couple. Like they were in there, they were kikiing with the doctor. I don't know how many they were I don't know. But they were in there, they were laughing, and you have to hold your urine. You can't use the restroom, right?
Oh yeah.
So by that time I had stripped down, I was in my robe, I was in my gown and everything. And oh my gosh, like I was like, they are taking so long. My transfer was scheduled for a certain time and they were already like 40 minutes past my scheduled transfer time.
Oh
And
yeah.
I was
I've
telling my
been there
husband, I
too.
was like, ask the nurse if I can go use the restroom. I'm sure that by the time they're ready for me, I will have my bladder will be full again. So the nurse is like, no, the doctor's coming, the doctor's coming or whatever the case is. And I'm like, oh my gosh, I am going to pee on myself, excuse me. So, they finally wheel me back there and, you know, um, literally when the doctor was doing like he was like we're gonna bring out the embryo, he's walking you through it, telling you what's going on. The embryologist brings out that they're going all slow and all of this, like, oh my gosh, we have to be so careful. I'm like, if y'all don't hurry, hurry up. And I told my doctor, I said, Dr. Payne, I'm gonna pee on you. I literally said
Right.
that to him, and he's like, it's okay, I get it all the time.
Yep, you do.
And I and I say it was traumatic because I felt so bad peeing on, like I ended up peeing on him, and I was like, girl, it was like tear. I feel so bad. This is just so crazy. But the nurse was, trying to comfort me, and my husband was in there. Everybody trying to comfort, she was trying to comfort me, just, you're okay, And I was just mad because I was literally like, I had to use the restroom so bad. And then he told me you could just let it go, kind of like thing. But I still didn't, because after
Right.
that, I was like getting up off the table or whatever, getting off the bed. But once the transfer was done, I I just kept telling my husband, all right, we need to, we're pregnant. We need to start preparing. I didn't wait for a confirmed pregnancy, so per se. The doctor did tell me, don't go home and start testing. Like, what? We don't, no, no,
Yeah.
no. But I actually started testing like 3 days after.
Miss Lawanda, she's in here. She was here
Mm-hmm.
early this week. She
Mm-hmm.
was like, "Why did I go home after my transferring test and got mad because it was negative?" I was like, "You know it was gonna be negative, right?" She was like, "Yeah, but I still got mad."
3 days. I started testing 3 days after, and I was testing with just the little HCG
No, ma'am, that's not gonna pick anything up.
right?
That's not gonna pick anything up.
So I had a whole book and I was taping them down, and I was like, oh my gosh, I don't see anything. My husband was like, you need to stop stressing yourself out. So I was like, all right, I'm gonna stop. I'm gonna stop. So I stopped for 1 day. I stopped for 1 day, and then the fifth day I started testing again. And that's when I started seeing something little. He was like,
A little
damn,
squinter.
yeah, you don't see nothing. I don't see that. I told him, you wear glasses, so you don't see it. I see it, right? Um, and I was like, well, I told you we were pregnant. I told you we were pregnant. And yeah, that was so, it was just like I said, like when you've never, like you've never experienced it before, like I already believed that I was because of the relationship that God and I had built. Like that confirmation was already there for me. Um, yes, it's only one. Yes, I was crying real tears. She said, yes, but you just get that when you see it and you've never seen it before. Like I've taken pregnancy tests before, but I've never gotten a
Right.
positive one.
Two lines.
And I even I was like, well, I went to CVS and I just bought like a generic brand of clear blue generic brand or whatever. And um, my husband came home and I had taken it and um, I left it in the bathroom for him. For first thing you do, you come home and use the restroom. So I left it in the bathroom for him, and I had saw the positive, but I wanted him to see it. And so, yeah, he came out with it like it's go time. That was it. That was it. And um, yeah, so after that, that was just so surreal for me. We waited a little bit to tell our family, um, just so that we could kind of like meditate and, just simmer on it. You know what I'm saying? But it was truly, truly like I just felt so blessed, and so the promise of God was being fulfilled, and I just continued to be reminded that He's so faithful. He's so faithful. He said it. He told me this. He told me that, and this is exactly what's happening. And so, yeah, that was like I just I was so excited, and I'm still on a high. Like I'm still I'm still on a high even now. But
Well, it's still fresh because you just had your baby a couple of months ago. So,
yes, yes. Oh my
and
God.
how was that? Now you said that the tube, your tubes being blocked was traumatic. Your
Mm-hmm.
transfer day was traumatic.
Yeah.
How was was your pregnancy and your birth traumatic?
No, well, it was, but y'all are gonna hear it here first, okay? Because normally I'll put it on YouTube or whatever the case is on my YouTube channel, but y'all will hear it here first. So my pregnancy was great. Like pregnancy was phenomenal. No issues. No issues. Of course, I also had to see an MFM doctor because of my
Right.
age.
Yeah.
Um, Graduated like after like probably maybe like my sixth or seventh appointment. They were like, you're good. We'll send you off to your regular OB. Um, like excuse me, everything was good. No issues with my pregnancy. Up until maybe like the last month and a half. That's when that pelvic pain started, and oh my gosh, it was there. Okay. Um,
Wow.
so yeah, that was like I didn't my pregnancy was good. Like I think I vomited one time, and that was only because I was on a work trip and I just got off the plane, and I think, all of
Just
that made my stomach upset. Um, but I didn't have like morning sickness or anything like that, or nighttime sickness or whatever. Everything was pretty good. My birth story, part of my birth story, I had a birth plan set out. I wanted a unmedicated vaginal birth. That did not happen.
okay.
Did not happen like that. I actually, my doctor, my OB, he did tell me, like, we talked about it. We talked about it in depth, and he was like, okay, you are going to be 40 when you have your baby. He did say, there's like, because he's done a lot of IVF births, because like I said, my OB partners with that fertility clinic that I was going with. And he did say, there is more risk with IVF births and pregnancies. And then on top of that, you are about to be 40. So he did suggest an induction at 39 weeks because there is more risk of stillbirth due to my age. And so I was like, okay, we'll go forward with the induction, but I still wanted minimal meds. And so, yeah, we had my induction scheduled for 39 weeks and get to the hospital, everything, I'm trying to prepare my mental, I got my aromatherapy, I have my birth plan. We had it typed up. It was, what we want, what we don't want. This is how we want the room. We don't want, any students in the room. We don't want none of that. We just, this is how we want it, blah, 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 what we want as far as once the baby comes out and everything. And, they start induction meds. I'm fine. The next day, they're like, okay, you're not dilating. So, like, I was at 3 centimeters for like a whole day, basically. And so my doctor was like, Orvia, what do you want to do? And I was like, I want this baby out. So he's like, all right. So we had to do cesarean, a C-section. And that was the third traumatic. Because laying on that table, getting cut open, like that was like, I didn't feel anything, but my doctor was talking to me. He's like, all right, this is what we're doing. I'm doing this, I'm cutting this, I'm doing this, I'm moving this one. I said, Dr. Iskander, I said, I don't want to hear none of that. I just want you to get the baby out. I don't want to hear none of that. I don't want you to walk me through nothing. Don't walk me through. Don't tell me none of that. I don't want to hear none of it. None of it. Just
I love that when you get like serious talk that your accent just pops out.
Get me off of this table, right? And I think my mind going to the fact that I was being cut open and I could not feel it and I was awake. And knowing that my baby was about to enter into the world, and knowing that it was kind of like surreal for me. I started vomiting on the table, on my back. I was vomiting.
Damn.
Yes, I was vomiting. Like they were suctioning as I was vomiting. My husband was up there and I would not stop. I was not stopping. Like I kept vomiting. And I couldn't even like it was not stopping. Okay, just leave it at that. She was suctioning as I'm laying, you're on your back, you got your arms to the table, you just imagine vomiting on your back and not being able to, get it
up or anything.
So that was, like I said, that was like the third traumatic part of the whole thing. But when my doctor was like, okay, and again, we didn't know the gender. So my doctor was like, well, you don't want me to tell you anything. Well, who's going to say what the gender is? I was like, my husband will tell me. So my doctor stopped telling me everything that he was doing. I was like, just get the baby out and let's finish this process. So my husband's like, babe, it's a boy. And then, of course, I just started praising God. And I just started praising God. And I was just so thankful because my baby was earthside. And we were, finally at this part of me becoming a mother. And so, yeah, the C-section was quick. I was stitched up within like probably 6 minutes. And yeah, they wheeled me back to the room. And like I said, my whole pregnancy was good. I didn't have no issues. I didn't have gestational diabetes. Blood pressure was always great, like top notch. It was like, oh, you're good, blah, blah, blah. Back to the room. I'm good. Stay in the hospital for another 2 days. I come home for 2 days. Thankfully, my mother came and my mom was here with us for 2 weeks. And so my mom was here with us and we were home for 2 days. And then I started feeling, like I told my husband, I was like, I don't know, I feel like I'm coming down with something. I was like, I just don't feel good. And I was having bouts of like not able to catch my breath. And one night, we had the baby in the room with us, and one night I was like, I just feel like I'm short of breath. And I was like, if I don't feel good, like I was sitting up in the bed because I felt like laying down, I just couldn't breathe. Like I felt like something was on my chest, right? And I told my husband, if I don't feel good in the morning, I want to go to the ER. He's like, in the morning? We need to go now if you're feeling like that. So we went to the ER, and my blood pressure was sky high. Like it was never high my whole pregnancy. They were always, oh girl, your blood pressure is great. Oh, it's only this over this. And I'm like, okay, good. And my blood pressure was like 180 over like 65 over 70, and it kept increasing. And because they were like, oh, this was like I was 5 days postpartum. And they were like, well, we're going to send you back to the birthing center. And I was like, okay. So my husband's like, they were like, we think that you have preeclampsia, postpartum preeclampsia. And so I was like, all right, we're going to go home, get some stuff. They're like, no, ma'am, you're not going anywhere.
Yeah, you're not going
anywhere. We have the ambulance coming for you right now.
Yeah.
And I'm like, what? They're like, yeah. Yes. So my husband went home, he got a bag, and I had to wait in the hospital for the ambulance. And yeah, my pressure was so high. So going back to the birthing center, and then those same nurses be like, weren't you just here like a few days ago? And I'm like, yes.
Right.
And get there, and my pressure continued to go up and down, up and down, up and down. Most of the time it was up. I was there for like 3 days. And the third day, it was like starting to stabilize. And I told my husband, I said, if they don't discharge me today, I need you to bring my baby, because I hadn't seen him like in a few days. And I was like, I need my son. I need him. And it was the birthing center. So I was like, okay, it's clean here. You know what I'm saying? He was just up here, it's babies all up here. So it's literally just a maternity hospital. It was separate from the regular hospital that I was at. So I was like, I need you to bring my son. If they don't discharge me, I need you to bring him. So that third day, he brought him, and the doctor asked for my pressure to be checked again. And my pressure had plummeted. It had went down. It had stabilized completely. And the nurse was like, oh my gosh, it's like you only needed your baby. That's right. I just like being away from him. I think that probably also had something to do with my pressure continuing not to stabilize, because I was just so worried about him. I know my mom was here with him, but like to go from having that baby inside of you and then you being away from them so quickly after, like I can't imagine mothers that have babies in the NICU, and you have to continuously, every day you're coming back to the hospital every day. Like, that has to take a toll on you. Like, it has to, because like not seeing him, like, it just made me so I couldn't sleep. It was crazy. But thankfully I was discharged that same day that my husband brought my baby to the hospital. And that was, yeah, that was crazy, because I was diagnosed with postpartum preeclampsia, and I didn't know that was a thing. I didn't know it was a thing, but it's a thing. It's very much so a thing. And I don't know what the reason was, but because, like I said, my pregnancy was great. I didn't have any issues, no gestational diabetes, no high blood pressure, none of that. And yeah, it definitely got to me. But after seeing my baby, my pressure stabilized and we were good to go home. So yeah, we've been home. He is 2 months, and tomorrow, unfortunately, we have to go and get his 2 month shots, and I'm dreading that, because of course I don't want anybody doing anything to my child. But yeah, so he's healthy. I'm healthy. Of course, I'm trying to get back to my old self. I'm dreading going back to work, but I'm sure we'll be good, because thankfully my mother is coming back into town, and she's going to be working from home from our house. I'm just so thankful for her, because of course, we don't really know anybody here. We were gonna put him in daycare, and my mom's like, no, y'all not putting my baby in daycare. And I'm like, well, what do you mean? Like, she's like, I'm gonna work from home in your office. I'm gonna be here with them. So that's a true blessing. But I look at him every day, and I'm just like, God's promises are true. He is so faithful, because he kept his promise to me. And everything worked out the way that it was supposed to. And I'm just reminded every day of the road that we took to get here to this point. And none of it matters. None of the doctor's appointments matter. None of the blood work matters. Me being on the table throwing up, that don't matter. Me being on the doctor don't matter. Me getting my tubes removed does not matter. All of that, me, being sad about having one embryo, that does not matter. It doesn't matter, because now I have my miracle baby, and I can truly say that if you really trust and have faith in not the process, I won't say that, because the process is going to have its pitfalls. It's not going to always be 100%. It's not, you're going to have times where your protocol gets changed. So, it's going to happen. You're going to get times where blood work is not going to look like it's supposed to look, or, this gets moved, or this appointment gets changed, or your cycle is not the way that it should be. Like, I don't want to say, I never say, like, I'm going to trust the process. I just trusted God, and in trusting God, it allowed me to put the process in his hands, so I don't have to trust the process. I just trust him, put the process in his hands, and he is going to work it all out, which he did. And I'm just so thankful. And in that, even at our baby shower, like, one of the things, my husband, I'm just so thankful, because we both have our own relationships with God. And I was even encouraged by the fact that me and my walk encouraged my husband, and he mentioned that in our baby shower. He's like, man, I watched my wife, do this and that. I watched my wife anoint herself, which I anointed my body every single night after my shower, from starting stims until the birth of our baby. Every night I anointed my body, and I said, God, I'm putting my body in your hands. I trust that you are going to work it out. And, he mentioned that like at our shower. And like, I never thought that he was really paying attention to me doing it. You know what I'm saying? But, it helped his faith and it grew his faith as well. And you just never really know like who you're affecting by just showing, or by really just trusting God and just putting your faith in him. And like I said, I know that, like I said, people say, well, if you really have faith, then why did you do IVF? I'm going to say it again. God didn't need help. I did. So he sent the help through IVF. And so if that's how it was supposed to happen, then that's how it was supposed to happen. And I'm not going to deny that. I'm not going to say that he didn't have his hand in it, because he definitely did. Because I know that if I would not have done what I did, I'm not confident that I would have my baby. I'm not confident that I would be a mother right now. And so, yeah, we got Mr. Jackson is over. He's in the room with his dad right now. He should be asleep right now, but yeah, Mr. Jackson, Pete, JP.
Well, the whole thing is, and I don't know why women's fertility, we feel like we have to put, that we can't get help in that we're just supposed to trust God. Because, as I say all the time, if something was wrong with my heart and I needed surgery, people would be all for that. If I needed knee surgery or hip surgery or any other type of surgery, yeah, you need to go see somebody about that. You need to go see a doctor. God created doctors to help us, so that we could have that, just like the what is the old saying, when the man was in the boat, he was sitting in the ocean middle by himself, and he sent like all these different avenues and he kept saying, no, I'm waiting on God. God said, I sent you 3 ways, you didn't take them. So it's like we have to look for those type of, now that's why you keep repeating that over and over again. It did not look like I was, and you're confirming that it did not look like how it was supposed to be. Because again, you're in your second marriage. You thought that when you got married your first time, that it was gonna be, you get married, you have your kids, and you go on with your life. And that didn't happen. And you got remarried again, and you're thinking like, okay, maybe I get married again, and then we have the kids, and that still didn't happen. You marry somebody with children. That probably was not initially when you were thinking about getting in a relationship. So we have to adjust to what the narrative is for us at that time, and that be okay. That you now standing here in your mama era, as your t-shirt says, grateful, thankful for the path that was taken for you, because it led you to your son. And nobody can take that away from you. And as you said, now you're looking back and you're saying, I wasn't supposed to have my baby with my first marriage. I wasn't supposed to have those things. And you see the way that God orchestrated your life to be where it is right now. And it was not all pretty. I know hearing your story, watching your content, it was not all pretty. But it was worth you getting to where you are right now. That you're looking on this monitor and seeing your baby, like, that's my baby. I'm somebody's mama. I am somebody's mama.
For sure. Yes.
And so, as we come to an end, what, so